I would like to again welcome you to this event. This event is brought to you by the cooperation between the host, GISTI, and collaboration with the Joop Lang Institute. So without any further ado, I would like to introduce you to our moderator for this morning, Robert Martin, Dr. Robert Martin. So Dr. Robert Martin is the Strategy and Partnership Officer, Unit Head at the Alliance for Health Policy and Systems Research. Robert is a public health policy specialist and leads the Alliance's work on non-communicable diseases, climate change, and the social determinants of health. He has more than 15 years experience working on health systems at the global and country level. Before joining the Alliance, he worked in the WHO India country office to help roll out national primary healthcare reforms and was previously the health systems coordinator for WHO in Sierra Leone at the end of the Ebola virus outbreak. He also worked as a Council of Foreign Relations Hitachi Fellow in Tokyo, Japan, and on the Rockefeller Foundation's Transforming Health Systems Initiative. So I would like for you to give a warm welcome to our moderator, Dr. Robert Martin.
Well, good morning, colleagues. Nice to see you here. Thank you very much for the kind introduction, Sophie. I'm very much looking forward to our discussion. I was hoping we would have our colleague from WHO, Dr. Calypso Chalkidu, here to give that opening address. Unfortunately, it sounds like she's been detained, and we hope she will be able to make it, detained by something else. You know, I think if she had been here with us, and hopefully, as I said, she will be able to come later, I think she would have touched upon the importance of domestic resource mobilization, the importance of value for money, the complexities of the political economy of political choices and difficult financing choices at this moment in time, right? As we already heard from Sophie, we are facing now a new era in global health, right? I think we can say over the last 25 years has been a special time, starting, I would say, in 2000 with the Millennium Development Declaration to about this year. We've had extraordinary investments, both global and domestic, in global health. We've seen huge declines in child mortality, huge gains in addressing important diseases, HIV, TB, malaria. But there's still much more to do, right? And I think now we have a broader global health agenda, looking at issues like NCDs, looking at issues like climate change. The SDG agenda is a much broader, more holistic goal. At the same time, we are now facing this very, very difficult global financing climate. So I'm very happy now to be able to invite some very distinguished, accomplished experts with great experience to join me up here on the panel. And I'm going to sit down and invite them up one by one, and I'll introduce them briefly so that we have lots of time for discussion. I'd like to start by inviting Alok Ranjan. He is the Director of Programs and Investments at the Power of Nutrition, based in London. Alok, please come up to the stage. Then I would like to invite Christophe Ben, who is the Director for Global Health Diplomacy at the Joop Lang Institute. I'd also like to invite Priya Basu, who is the Executive Head of the Pandemic Fund Secretariat based at the World Bank in Washington. Then Samu Kuni, Professor Sam, the Chief Executive Officer at Jihad Fund in Tokyo. And last but not least, Dia Satyani Seminase, the Chief Executive Officer, CEO at GISTI. So, I'd like to give a warm welcome, if we could just have a round of applause for our panel. Excellent. So I'd like to start with you, Professor Sam, because I know you also have to leave a little bit early this morning. But I think we all recognize the constrained fiscal environments. I think we know countries are under pressure to stretch the already limited resources, right? I think there is potential around innovation and data systems to help us be able to do more with less. But Sam, maybe you could give us some reflections upon this. I mean, how can innovation and data be better leveraged to guide smarter, more equitable allocations? And how can we ensure that these tools are localized, right? That they're not coming from Tokyo or Geneva, but that they're actually developed in the countries where we're trying to work. Over to you, Sam.
Okay, thank you very much. So I'd like to share my experience in UNICEF headquarters as a strategic advisor, and also in a global fund. 9 years I've been head of strategy investment impact division, and actually the Calypso, I kind of recruited the head of Department of Health Financing. So, okay, so first, we set a target, global target, in SDG 2, and there are very clear target in each, the goals. So, for example, that the TB, we set the target 95% reduction of TB incidence by the year of 2035. But current trajectory is just only 2% annual reduction of this incidence. So, if that trajectory goes, reaching the target of 90% of reduction is 2180, another 150 years, right? So we really have to, bend the curve, right? So for bend the curve, we need to optimize all kinds of resources, yeah, and avoid duplication and make a efficiency and select that, very effective and efficient way of intervention. And also we need innovation, okay? So we really need innovation. For example, TB, we need a much better, better, cheaper, faster kind of diagnostics, and better and safer vaccine and therapeutics. So for that purpose, we really need that data. Okay, we really need to have a data, and also need to share those kind of data, and sometimes lesson learned and even failure with other, stakeholders. And in Global Fund, we always have, we had the Department of Strategic Information, and we gather lots of data from all the countries, and we usually, for replenishment, we set the kind of investment case, the measuring all kind of disease burden, and also external funding, and also kind of human rights and gender and the vulnerable population. Because cost-effective intervention important, but we always have to see the people left behind. Because sometimes, reaching out those people, not cost efficient. Sometimes very, have to spend much more money for that, but we really need to do that for that equity. So we always have to look at those kind of scaling up, at the same time, last 1 mile and last 1% of the people, left behind. So those kind of things also we can use the data and kind of modeling. So we had a partnership with the Imperial College or the Washington University, Chris Murray's team, etc., for getting those kind of data. And other one is working with civil societies, always, because sometimes data cannot tell all the detail, right? So we need human rights issues and etc., and qualitative issue from those, the people working on the ground. So those kind of qualitative and quantitative data and more kind of narrative, both are very important. Maybe better to stop here.
Thank you. Thank you very much, Sam. I think that was really helpful, the importance of both qualitative, quantitative, thinking about bending the curve, thinking about the importance of equity, reaching that last mile. Very, very insightful. Thank you.
Sorry, maybe before leaving, I also want to say mobilization of resources. Actually, that Christoph is much experts, but nowadays I want to say, because so far we are very much dependent on donors, right? But we really need to look at that global south. For example, Indonesia, Thailand, and other countries I visit, there are a lot of kind of advancement. They are very eager to work for even other countries. So there are some money there, and also there are some innovations and power innovation. That is why we really need to think about real kind of partnership. And when we have money, sometimes we don't see some of the very important things because we are concentrating on using money. But when we don't have money, we can see the variety of things, right? So now is a pinch is chance, I feel. So how to just make a better efficiency and also collaboration, because when I was working in Global Fund, I tried to work with WHO or World Bank, etc. for especially health system strengthening, but sometimes fail because everyone is busy and sometimes not thinking about this collaboration. But now is a very important time for that collaboration, integration, and coordination.
Thank you, Sam. No, excellent. And I think that issue of domestic resource mobilization is critical, and I'm sure we'll come back to it. I think we are seeing countries increasingly turn to that because it is probably the most reliable, most sustainable form of financing, right? We always talk about sustainable financing, and I think domestic resource mobilization is probably the best for that, often overlooked. There are, what I think sometimes people say, a growing array of financial tools, right? And we think about innovation, we think about debt swaps, blended finance, new mechanisms, new platforms. Sometimes I feel like it's kind of alphabet soup of acronyms and tools, and sometimes it's almost overwhelming and confusing, right? There's so many different ideas, and I fear sometimes that we might be losing the thread, right? Losing the kind of trees in the forest with all of these gadgets and gizmos to be able to help us. And so, Christoph, I was wondering if you could help us make sense of this a little bit. You have a wealth of experience. I mean, are these new tools, people talk about blended finance or debt for health swaps, are they really helping countries close this gap, or are we just adding more kind of complexity to an already extremely complex system?
Thank you, Robert, and thank you also to put me together on a panel with Sam. As you could hear, we've been close colleagues in the Global Fund. I had to raise the resources to the replenishments based on Sam's data. So, we work very closely together on that. And I'll come to your question on innovative finance, because you're absolutely right. Everybody talks about innovative finance as if there was a magic pot of money somewhere, and that would finance all these initiatives. And we have to have a realistic understanding, what it can do and what it cannot do. But before getting there, some of us are sitting on many panels this week on, health financing, because it is the top issue for WHO itself, that is organizing the World Health Assembly, but also for all the other, global health organizations and initiatives. And many people rightly talk about the end of an era, the era of, development assistance, development aid, and so on, and that is correct. And it's not just the kind of decisions by the US administration, there are many other countries as well, and the general sense that, okay, this was an important era, but that had to change anyway, right? And we need to change the kind of paradigm of donor-recipient relations and talking about aid and assistance. That actually had gone a while ago, but now it is becoming much more acute, if you like. But at the same time, when we talk about the end of that, we should not assume for a second that the investments in global health and in global public goods are not required anymore. That would be a huge mistake. The opposite is true. Actually, the world needs more investments in many global public goods. And if we just look at global health, yes, domestic finance is absolutely important, but for many countries that are also facing, increasing debt burden, then to tell them, not only do you have to maintain your health systems, but you have to make massive investments in making your health systems more resilient to future pandemics, which is such an important topic, and that's why we have the pandemic fund, And it's not a kind of finished business, right? I mean, we need much more investments in pandemic preparedness and response. And we have to help countries to make their health systems more resilient to climate change, the big challenge for the future. This will require huge amounts of resources, well beyond an appeal to, national ministries of health. I mean, you just need to allocate a little bit more to your health budget, right? So we should not mistake that for this is all not required anymore. What we need is a paradigm shift, also how we think and talk about that. Some of us, including Ivo Dea, we've been talking about global public investment for quite a while, right? I mean, we need massively more public investments in these global public goods, but on a different basis, not the kind of donor-recipient base, but much more every country, contributing according to their means. And I think there are good examples here, and not only because SISTI is our gracious host here, but we've been working closely together also during the Indonesian G20 presidency when the pandemic fund was created. And I still think the kind of initial pledges of Indonesia, China and South Africa and others to the pandemic fund were a kind of almost a symbol of this changing perception. It's not just the few traditional donors who have to fund these kind of initial international initiatives, but also many other countries. And Indonesia since then made pledges, generous pledges, also to WHO 30 million, to Gavi 30 million, and so on. If we take that as a model, there are many, many more middle-income countries, even high-income countries, who can make pledges like Indonesia, but it requires a different mindset to kind of, make these investments. So now coming to innovative finance, because also people think, this is something else, right? This is not related to kind of public investments in development. The opposite is true. Almost all the innovative finance instruments that many of you will know and have heard about, they start with public investments, right? Whether it's Gavi's IFIM model, you basically take long-term pledges, from public donors. And then you go to the financial market and you mobilize, you front load basically the long-term pledges of public donors to kind of free up this money. Blended finance is nothing else but using public sector money that is often given to development banks and then try to combine that to kind of leverage resources, but it starts with public sector governments making contributions to development banks, whether it's regional banks or World Bank and so on, but it always starts basically with public sector investment. And then you can blend that and deliver that in different ways. You asked me specifically about debt swaps. It's exactly the same thing, right? Debt swaps means there is a kind of creditor country that decides they will, cancel a certain amount of debt, and then the kind of debtor country converts that into investments, in this case in but it starts again, it's a public sector, deal. And again, Indonesia is one of the leading examples here. Indonesia has a lot of experience with, debt swaps. Just last year concluded 2 new ones. And it's a good model, if you like, because it addresses both, challenges at the same time. It reduces the debt burden and it frees up money for domestic investments in health. That's what it is. So, but your point also, aren't many of these instruments too complicated? Is it manageable for countries, right? That's a very legitimate question, and I have also many examples from the time in the Global Fund. We also tried blended finance and so on. It sometimes takes years, and it's very complicated to kind of, match grant funding from like the Global Fund with concessional loans from development banks. It's in principle a good idea to leverage that, but can be very complicated. And some other, innovative finance mechanisms are like that as well. Debt swaps, I often say, it's as complicated as countries want to make it. It's not intrinsically, complicated, but if a country starts from scratch, they've never done a debt swap, and then they have to establish the structures and so on, that can be complicated. Indonesia is an example where you've done many debt swaps and is going relatively well, if you have that experience. And I'm happy to say Indonesia, I think I've told you, Dia, that the Ministry of Finance of Indonesia agreed to co-host a side event with our institute, Yublang Institute, and the Global Fund at the upcoming Financing for Development Summit in Sevilla. Because debt swaps have been mentioned several times in the outcome document. And we want to kind of invite for a side event there to explore that further. And exactly again with Indonesia building on that experience and explain it in a way that other countries could then, maybe apply that as well and see, it's not that complicated. It's basically two political decisions from a creditor country for a debtor country, and then you can do it. So, yes, innovative finance is not just the magic wand. It can be complicated, but it has opportunities.
Excellent. Thank you very much, Christoph, for that clarity and that wealth of experience. I think that's very helpful. The recognition that it can be complex, but it also can be very useful, right? And we are, as you said, we need a paradigm shift, right? We need to move kind of beyond development into a world about thinking of global public goods, right? And how we can jointly finance that, how we can leverage public sector resources for greater impact. Excellent. And you mentioned also the pandemic fund. Obviously, this is one of the more prominent examples of new financing tools. I think, and in the wake of the COVID experience, I think there was a great appetite for helping countries manage some of these risks. And thinking through pandemic preparedness, right? Pandemic preparedness, right? It's always easy to think about that afterwards, right? We all know what we would need to do now if we face a new COVID pandemic, right? But unfortunately, we don't know what sort of pandemic we need to be prepared for in the future, right? It's obviously difficult to predict. So it's very hard to understand, what exactly always is pandemic preparedness. Who defines it? How do we think about that? And Priya, I want to come to you now to see if you could share maybe some lessons from thinking about developing the pandemic fund. How do you address those concerns about, whose voice or whose understanding of preparedness matters? How do you think about governance, trust, dependency to ensure that when we do have a pandemic, we're getting the resources that we need in response? So Priya, very keen to hear your experience and advice on this.
Well, thank you so much, and thank you to Chisdi and Ibudia for the opportunity to share some of the early lessons and experience of the Pandemic Fund. So for those who are less familiar with the Pandemic Fund, we were created in 2022, formally launched in November 2022 at the G20 Finance and Health Ministers meeting in Bali, when Indonesia was hosting the G20 presidency. We are the first and only multilateral financing mechanism that's dedicated exclusively to investing in pandemic prevention, preparedness, and response in low and middle income countries. And as you said, we come out of the lessons of COVID-19, but also past pandemics, SARS, MERS, avian influenza, Zika, Ebola. Each time there was a pandemic, there was panic, and then, money was spent, but then, in so-called peacetime, those investments began to fade, and, we fell into cycles of panic and neglect. So the international community was really determined this time to once and for all, make those investments that are needed to get all countries to the right levels of preparedness. And so we were created at record speed. 28 donors came together, including, as Christoph was mentioning, both your traditional donors, the G7 countries, but also very interestingly, Indonesia, China, India, South Africa, all came with resources to help us raise an initial $2 billion. And then most recently, we've managed to mobilize an additional $1 billion. So now we're at $3 billion, which really shows the confidence that our current donors have in us. And we're working to grow that. So now, in terms of the model and what are the lessons? So right from the beginning, there are some sort of key principles that have been baked into the design of the Pandemic Fund. And one is that it is catalytic. It is a catalytic financing structure. and it is collaborative and coordinated in the way in which it delivers financing, and it's not duplicative. So it's not trying to do what other international institutions are already doing. It is working through them to leverage their strengths and expertise to ensure that money does go in these critical areas of pandemic prevention, preparedness, and response. It has a very inclusive governance structure that also reflects the composition of its donors. We have an equal number of seats for contributors and what we call co-investors, who are the countries, the 147 countries that can receive money from the pandemic fund. We have 2 seats for civil society. Dia has been our civil society Global South representative, and Loretta, who's in the audience, is our civil society Global North representative on the board. So we're listening to the voices of civil society and communities, which are absolutely vital. So you asked about governance, trust, dependency. So I want to make the point that the pandemic fund takes a very country-led, country-driven approach. We're not telling countries where they need to invest. Rather, our model is such that from time to time we issue calls for proposals, and we tell the countries to work. And when I say country, I don't mean just the government, and all of society kind of approach. So we ask the countries to put together proposals in consultation with communities of civil society, in consultation with the various international agencies that are, perhaps knocking at their doors, offering, resources. But we're saying let the country take the leadership and, bring together, domestic and international partners and submit proposals that really help to fill critical gaps in key areas, and those key areas were also kind of determined through a very consultative process, and they are right now surveillance, early warning systems, laboratories, and health workforce. So, so I want to emphasize that we're not sitting in Washington or Geneva and telling the countries this is what you need. We're saying, well, based on consultations with you, these were the kind of broad areas that were identified that are needed to build kind of the minimum infrastructure, systems, workforce that's needed to help countries get prepared to be able to not just detect and contain health outbreaks, but also manage an outbreak and prevent it from spiraling into a pandemic. And then maybe one final point, which is on the financing itself. So in a way we anticipated, right now we're in a world of challenging development financing, international financing. But when the pandemic fund was created, we already anticipated, and we recognized that you cannot create a fund that's sort of eternally dependent on external financing. So that's what our catalytic model is, that we say that for every dollar of grant financing that we're awarding, we want to draw in additional resources, both from existing international partners, but very importantly from the countries themselves that are receiving money, because this is absolutely vital to sustainability. And I have to say that in this world of global health, it stands out because there's a lot of dependency on aid, particularly in regions like sub-Saharan Africa. It's not the same in other, in many other sectors, but in global health, there's this kind of vicious cycle of dependency. So when we created the pandemic fund, we said, look, this is scarce taxpayers' money, donor funds, but we want to see for every dollar that we award, we want additional resources to be mobilized. So we've managed to achieve a leverage ratio of 1:7. For every dollar of grants that the pandemic fund has awarded, we've managed to mobilize $7, about 4 of which comes from multilateral development banks, etc., and 3 comes from the governments themselves. But in some cases, we're actually seeing a much higher, contribution from the government that's receiving money. We're seeing 6, 7, 8 times as much of as the grants we're putting. And maybe one final point, which is that blended finance is baked in our model. So this is like grant money being blended with loans from NDBs, and there's nothing particularly complicated about that. you know, it's happening, and it's happening, you know, very well, and we would like to see more of this happen. So thanks.
Well, thank you very much, Priya, for those insights, the experience. I mean, 3 billion, congratulations. I think you very helpfully reminded us about the importance of co-production, co-creation to ensure ownership. You also, I think, you know, talked really nicely at the end there about the importance of ensuring that we're moving away from a dependency model, right? And that we are doing this together, we are bringing in domestic resources. And I want to use that as a segue into a discussion now with Alok. I mean, you know, incentives matter, but getting the co-financing mechanisms in place to be able to draw on those domestic or national resources also matter. Understanding those systems, how they work. How can we make sure that these funding mechanisms are aligned with kind of domestic political systems, policies, processes, and be designed in a way to really garner the national investment that we want, right? To be able to, as Christophe was saying, kind of leverage those public sector resources beyond the initial investment. Alec, would you want to maybe share some experience or thoughts on that?
Sure, thanks. So I'm from the Power of Nutrition. It's sort of an orphan sector is what we say, and post the whole funding scenario that's happening right now, it's even more impacted than many other sectors that we talk about. It's really great coming onto this topic after Priya mentioned about the journey of the pandemic fund. It seems like there is a lot of parallel in terms of what I'll be sharing here. Power of Nutrition was created in 2015. So CIF, Children Investment Fund Foundation, DFID, now FCDO, and UBS Optimus Foundation. They came together and created the Power of Nutrition in 2015. It's a 10-year journey. We are celebrating our 10-year birthday this year. So there are, I would say, 3 messages coming out of the last 10 years, which responds to the question that you have posed. And the 3 mechanisms have not been like clear-cut, this is the phase 1, this is the phase 2, phase 3. All 3 have overlapped across the 3 phases, but there has been prominence. The first one has been in terms of the leveraging the concession loan. Out of the 647 million, which is the portfolio size across all the 26 investments that we have across 17 countries in Africa and Asia, majority, the lion's share, is what we do with World Bank as the partner that we end up funding into that mechanism. And it helps our, say, for example, 10 million going into a program with World Bank, helps leverage something around, say, 40-50 million of IDA loan that's being designed between World Bank and the government. What this 10 million from our side helps, it helps us and our donors whose resources we bring together, because they see a big leverage in terms of the financial leverage, in terms of the impact leverage and the reach leverage. For World Bank, it becomes as a very strong mechanism where the IDA concession loan discussion they are having with the government, it becomes a bit more evidence driven. It becomes a bit more focused on data, because that's what we prioritize when we come with our, say, 10 million into that program. And for government, it becomes a value add, which is like, apart from the IDA concession loan, this is additional grant funding that they don't have to pay back. So it's a sort of a win-win situation for everyone. And almost 430 million of the 640 million is a partnership with the World Bank through 9 investments across 8 countries at this point of time. So that is one principle. The second model that we have seen majorly, which worked for us over the last 10 years, is the match funding model. And that's where I'll come with the example of our second implementing partner, where we partner and fund through UNICEF. So I'll give an example. Like DFID provided us platform funding. So if, for example, we raise new 2.5 million from our ex-new funder, we could match that 2.5 million through the platform funds that we have. That became 5 million. And then when we co-create a program with UNICEF in a country, they have to bring equal matching amount from their side. So 5 million from our side, new 2.5 million new funder, 2.5 million the platform funds that we had. But UNICEF brings matching 5 million from their side, which is UNICEF's funding, as well as a lot of places we have domestic resource allocation being mapped in the match funding that they bring from their side. So this is the second model, which is based on the match funding model. The third aspect which really worked pretty well in last, I would say, 10 years is, and more so in the later part, is the multi-sectoral integrated approach, because with the FCDO funding cuts happening post-2021, our match funding model got an impact. But what we saw started working is, since nutrition is an outcome of multiple deprivations across different sectors, so it helped us reach out to new funders who have not been funding nutrition, but say who are funding social protection, who are funding early childhood development, who are funding WASH programs. But bringing that and pooling that resource with funders who are already interested in funding nutrition or health and nutrition, it becomes a sort of matching mechanism, which earlier we were not prioritizing so much, but it became more and more relevant. And it helped for nutrition outcome as well, because as I said, nutrition is an outcome of multiple deprivations happening at the same time.
Okay, excellent. Thank you very much for those insights, the experience around match funding, multi-sectoral investment funding, really helpful. And I think you get us also into a segue coming to Indonesia, coming to Ibu Dia. Dia, you know, obviously we hear a lot about, again, this global financing. I mean, I think sitting in Indonesia, you've already been transitioning away from a lot of this global funding. And as we heard from Christoph earlier, you know, Indonesia itself is now in a position to be providing funding to some of these global public goods, some of these global efforts. But I wonder, you know, as that happens, is there a way that we can ensure that there is kind of continued ownership, right, of these global issues, of the funding? How can we make sure that equity is part of the conversation? How can we ensure that it's not just governments, you know, identifying some of their maybe pet issues? How can we ensure that there are civil society voices as part of that? And I'd like to also go back to something we talked about in the beginning about the importance of domestic resource mobilization. So big questions for you, Dia, but would love to hear some of your reflections from Jakarta. Thank you.
Thank you, Robert. I think it will take a logical framework, a theory of change, and extended essay to answer your question. I identify a few items that you asked, actually, and I will begin from ownership. I think ownership is born out of engagement, meaningful engagement. So once civil society is being meaningfully engaged, ownership will grow. But that is only the first step. The second step is the co-creation and co-production. It grows also when you are being asked and really being taken into account, your inputs are being valued, then ownership will grow even more. So what Priya mentioned about civil society engagement in the governing board of the pandemic fund, I think is a huge step, because that will grow over time. And I'm hopeful of that, because the pandemic fund asks or require multi-sector collaboration, multi-actors working together for that. So ownership will grow over time. It's not something that can be instant. Also, ownership will bring the drive to mobilize resources. Christoph laid out more about the government side of things, where it's going, where money is going to, money mobilized will go into global level and national level. But there is that room or that space where it still needs to be filled, and that will take about a lot of imagination and creativity to mobilize resources there, to mobilize communities, to work alongside government, but not necessarily tapping on the government resources. And that can come from private sector, and government can be a stakeholder in it. mobilizing or funding areas where it aligns with the government's priorities. But community level needs to be filled as well. And of course, when you go back to civil society, then the question to us, I think always where to fill the gap. Filling the gap does not mean filling the gap of resources necessarily, but more towards filling the gap of areas where it needs resources, but it's not on the priority list somehow. And that is where advocacy will come in, that is where civil society campaign, and that is where research will come. And I think that is the important element of that, because how can you advocate or you campaign without data and without scientific evidence? Now at the global level, things have changed, and we cannot shy away from we as a national level cannot shy away from this changing landscape, and it requires a different strategy altogether. Now, Indonesia has resources, and other countries similar to Indonesia has resources. The question is how to make sure that these resources are backed by a strong political will that remains throughout and beyond political cycles. So this is the challenge, but that is a fight for another day, and that is a fight for people like Christoph to tackle. I think that will create collaboration. With that, we have now the pandemic fund that is also funding a catalytic program in Indonesia, and I think we should then look into the map and see where civil society, private sector, and domestic resources can come in. That will grow the ownership, and that will influence priority of the government and also influence the priority at regional and global level.
Excellent, brilliant. Well, thank you very much, Dia. I think that was very, very helpful. The importance of meaningful engagement, ownership, co-production. I think that's a nice segue into the next stage, where we'd like to invite all of you to maybe ask some questions. We have about 22 minutes left. I think we should have a discussion. So I think we have one mic here. Maybe we can begin to pass it around. And if people would like to introduce themselves and ask a brief question, I think we'll maybe grab a handful of questions, and then we'll come back to our panel to offer some final reflections. So who would like to start? All right, I'm going to call on someone if someone doesn't volunteer. There we go. All right. It's always hard to be the first one, but
yes, indeed.
Once we get one, then the others always follow.
I'm really just curious.
If you could introduce yourself, please.
Richard Moser. I'm from the University of Massachusetts and part of the G4 Alliance, which is all about improving access to safe, affordable, and timely surgery around the world. But you've made several examples of blended financing and this and that, and I'm just wondering if you took any of those examples, how is success that you accomplished collecting $10 million, or what is the measure of success that you have in such a program? An example being UNICEF plus the power of nutrition plus the government. How far do you look then as to what success looks like?
Perfect. Thank you very much for that question. I think we had another question over here.
Lady.
Yes, thank you. My name is Ilva. I'm from the Digital Connected Care Coalition, which is a coalition that unites mostly private, but not only private partners to pool resources and bring united forces to get more care to people in low middle income countries and universal health care. And my question is a bit from a different perspective. In the beginning of the panel, you mentioned that we need to look at partnerships differently. And I'm curious to see your point of view on how do you see effective partnerships would look like from this current paradigm that we are entering in, and maybe if you can also mention how do you see private sector being a part of it, not only with funds but with other sorts of resources. Thank you.
Thank you. All right, we're going to grab as many questions as we can. Please maybe right here. Sure.
Dr. Clotilde Monguia, I didn't have a question, but following your questions, I do have one now. So thank you for organizing this panel. I'm from DRC Congo. I work in Nigeria, Gabon, Senegal. I live in New York 40% of my time. And the question is that we are from the low-income countries. I'm probably one of the few here because I don't need a visa to travel, and we are the one we need. So how do you bring the message to us? Or do we get to you? Or do you explain in very simple way all those wording, and particularly in French?
Thank you.
So,
very important question. Thank you. I think we have one more here.
My name is Siddhi. I work with Vital Strategies based in Singapore, and so I'd like to pick up on the shifting of funding landscape. There's a lot of effort going on in Asia Pacific to coalesce the private philanthropies around bigger goals, because often the mindset of working with bilaterals versus private family foundations or philanthropies needs to be slightly different. We're all motivated by the goals that we have, and especially as a philanthropy partner, the alignment of our goal to make it a larger goal so that funds can be pooled together and results can be achieved in alignment with the regional or country-specific strategies. So I'd be interested to hear from your perspective, from the Global Fund experience and in terms of the design of the Pandemic Fund, how are structures that have been in place at the regional level or country level being challenged to accommodate a newer breed of donors that do not respond to the same program designs or the same whistles and bells and kind of program design elements, but make it more conducive to increasing the pot, which is what I'd like to hear from you.
Excellent. Thank you. Very timely question. Another question here.
Thank you. My name is Hanna Baramian from Ipsos. Ipsos is a research agency which help UN and other international organizations with collecting data, because we are collecting data on the ground. So my question is, in this new situation, where do you see really the priority of the data? Is it in the needs of beneficiaries? Is it in the impact assessment of the current programs? Where do you see the main data need? Thank you.
Thank you very much. Excellent. We have another question over here, and then I think that might be it for the question. Let's see.
Hi, I'm Loretta Wong from ACE Healthcare Foundation. I'm also serving in the board of the Pandemic Fund, representing the Global North Civil Society. And it's an honor actually to sit with many friends and new friends in here to share some of the ideas that we have. And it's very unfortunate that most of our work are actually shaken into its core, that it really forces us to think differently and to work on things that we do every day, and we have to do it differently. So, so I have a question for the speaker, is that there are many global health institutions around the world. Many of them are based in Washington, D.C., or some of them based in Geneva, or some other parts of the world. So in this new landscape, how can these global health institutes work together and partner together and to reshape the landscape? Maybe more joint collaborations on even maybe upcoming replenishments, for example. So what will be the prospect in this area? Second question is, my brain sometimes is a bit like funny. So I'm thinking that if I were the president of Indonesia or the prime minister of Thailand, I woke up one day and many of the like institutions and governments started to say, oh this is middle income country, you're so important, you can like chip in with many resources. How am I going to respond with this new landscape, and how will you pitch this idea that you are the new donors, new baby, new darling, of the global health financing? How to pitch it also to the regional development banks, for example, and all of a sudden it's like, we should work very closely together. So what would be like the main pitching point, to this new darlings in the global health financing arena? Thank you.
Excellent, thank you. Well, a great round of questions. Thank you all. A lot of expertise, obviously, in the room. I think we had some questions there about, how do we make that pitch to those new donors? How do we move outside of DC, Geneva? How do we work with these new partners? Not only pitch them, but how do we manage the structures? How do we align them? This is something, I think, a very live issue for many global health institutions. How do we also connect and translate across languages, across cultures? How do we ensure effective partnerships? How do we work with the private sector? What is success, right? Is it just more money? Or is it sort of outcomes? What are we looking for, right? Obviously, I think we get fixated sometimes on the money as something that's very countable and measurable, but it's, I think, only a stepping stone, right? So a lot of really helpful questions. I think we'll just maybe go back, and I'd like to start with you, Alok. If you don't have to answer every question, and please don't attempt to do so, but maybe if you want to pick one or two, offer some final reflections, it would be very helpful. Thank you.
Sure, thanks. And I think, Richard, your question was probably addressed to me in terms of that 10 million and what do we measure success with that 10 million. So it's really timely for us to respond to that, because what we have done in the last 6 to 7 months is do a sort of impact and learning series internally, working with different sort of academic institutions, looking at what is A, the reach of our program, B, what is the impact in terms of the life saved. So with Modern Scientists Global and John Hopkins, we have undertaken this whole analysis which is looking using the LIST modeling, life saved tool model, looking at the stunting averted, anemia averted, as well as looking at the life saved, and they have new additionalities in terms of the educational years gained as well as the economic impact of all these interventions. So we have all those coming out. We just launched our impact report on 15th of the last week, on 15th May, and we have a webinar on 3rd June where we are kind of sharing all these findings that's coming out. But just to your question in terms of being a bit more specific around those, I'll give you an example of what we have done in Maharashtra. So it's a $10 million program, very much the number that you said. We put in 5 million, UNICEF brought in 5 million, their resources and government domestic resource allocation from their side in terms of the 5 million. We looked at the entire continuum of evidence to policy to implementation at scale. For us, 3S is very important. Scale, delivery through the systems, and in an approach which is sustainable. So with that initial 10 million, it looks like where it is right now, it was a drop in the ocean, to how much government has now put in place to take that whole pilot work in few districts to the entire state, and that scale up is being done by the government system itself. But based on the evidence of what was done and tested and what insights they got out of it. Our funding, along with that initial phase, evidence creation, helping with the policy and initial implementation, is mainly at the technical assistance level, which is in terms of ensuring the quality of the rollout, at the quality of the scale up as it is happening, gathering the data and supporting government system to understand what the data is speaking, where things are happening, the quality assurance of that. And it's really interesting that now that program is not just happening in Maharashtra in India. That same structure, the same thing is supporting multiple states in India to take that learning, but also it is going to different countries like Sri Lanka is adapting the same model. So that's one example, but for us, out of the 26 investments that we have, this oversight I gave you of reach of 180 million and the number of lives saved all is at the portfolio level. But each of our 26 investments has a different monitoring, learning and evaluation aspect. Some is having a very clear-cut baseline endline. Some has a kind of a process evaluation component that helps us to evolve. Some has very rigorous formative research and implementation research component at the start. It depends on what sectors, what investments, and how are we designing that program. That's how we look at the success of the program. But for us, the 3S, again, the scale, sustainability, and done through systems, not as a pilot which cannot be scaled later on. So we don't believe in pilotitis or graveyard of pilots.
Thank you. Christoph, please.
So maybe I first combine the question of effective partnerships also with the private sector with your question about philanthropy, taking Asia Pacific as a particular example. I think the private sector is a very important partner for many of the international organizations here on the panel and, you know, not in the room. But there are many different roles that the private sector can play. Almost all of the big international organizations in health, climate, probably education, you know, nutrition as well, work closely with private sector also in the countries and the implementation of programs using their infrastructure, expertise, capacity, and so on. On the topic that we are discussing here, where do the resources come from, we can't avoid the question also, you know, what's the private sector contributing in terms of financial resources? It's both, right? And I know from many negotiations with private sector partners, they don't want to be singled out just for making a financial contribution. They want to be seen as a comprehensive partner, giving money, but also supporting, you know, program implementation with their expertise. So that normally that happens, but we always need to emphasize it's both sides, right? I mean, you're expected to contribute, and you're, you know, a very valuable partner. When it comes to philanthropy, I think Asia Pacific is a particularly interesting example where there has been a lot of progress, I would say over the last 15 years, mobilizing major foundations from Singapore, from Indonesia, from Thailand, from Vietnam, many others. The Globe Fund was involved in that, you know, from about 2012, and with some success. There were kind of, you know, major philanthropies contributing then to the Globe Fund. Again, Indonesia was a shining example with Pak Tahir's foundation making major contributions. But also just recently you had, you know, a philanthropic summit in Singapore, right, attended by Bill Gates and others. So I think there's even a new momentum. So what I described, you know, has happened already over the last 10 years or so. But I think there's a new drive to kind of appeal to philanthropies, and they have, you know, financial resources to contribute to, you know, these global public goods. And that applies to many other regions as well. But I would say Asia Pacific is a bit advanced on that. Maybe I stop there.
Perfect, Christoph. Thank you very much. Priya.
So I won't repeat what's already been said. Perhaps on the question of how do we, you know, the question on success. And clearly, of course, success is not simply around being able to catalyze $7 for every dollar of grants awarded, or $10 for every dollar. I mean, that's obviously good. It's you know, it helps multiply the impact of scarce donor resources, and importantly, it helps you know, catalyze domestic resources, which are very important for sustaining the kinds of efforts that that funds like the Pandemic Fund make. But obviously, you know, success is not just measured by how much money you can mobilize, and success is measured by the outcomes and impact that you create. And in the case of the Pandemic Fund, we have, you know, a rather kind of well thought out results framework that has, you know, many different indicators from outputs to outcomes to impact. And ultimately what we're trying to do is to help countries quickly detect emerging infectious disease outbreaks and prevent them from spiraling into pandemics. And we have many ways of measuring those, but one good way is the 717 index that Resolve to Save Lives has come up with. I mean, it's very ambitious. 7 days to be able to detect, 1 day to report, and 7 days to contain. But you know, one can use that frame to for example, measure how you're progressing in real time. But then, you know, over longer periods of time, we have the WHO's international health regulations, which are, you know, now we'll soon have the amended ones, and they help us, you know, measure through the JEE tools. But it takes time for countries to move from level 1 to 2 to 3, on that framework. So then we have kind of ways to be able to measure success more quickly. On the private sector role, really agree with what Christoph said. The private sector is involved in many different ways. So we would love to be able to mobilize more money from the private sector, including those arms of the private sector that really suffered during the pandemic. There were some that gained and there were some that suffered, who wouldn't want another COVID-like pandemic to happen. I'm thinking here of tourism, of shipping, of logistics, right? So, that's kind of, so the private sector can be a donor, but it is already engaged, very much in the delivery. When you're building a new wastewater surveillance plant, or you're manufacturing diagnostic kits, testing tools, whatever, all of that is coming, from the private sector. When you're upgrading laboratories as well, private sector is involved in delivering workforce. Private sector companies are out there delivering training programs. So, they are an intrinsic part of what we do, and public-private partnerships are what we create. And to vital strategies, to your question, I would really like to, now he's looking at his cell phone, but I would like to actually turn the question back to you. Tell us, what is it that would speak to Asian philanthropies, what would resonate with them? Because we would really love to diversify our philanthropic base and get philanthropies from East Asia, from Africa. It's not easy though, I have to say. So any ideas that you have that you can share, things that would resonate in this, in the agenda that we're engaged in here on, investing in critical pandemic prevention, preparedness, and response capacities, would really welcome a side conversation on that. So thank you.
Thank you. Dia, please.
Thank you. I think I will begin from Loretta's question. That's the anchor to my response. I think right now, in any other day, I would answer that we bring a pilot as a test case and approve. But right now, we have moved past beyond that area, that timeline. So we have to bring something that we know will work, or something that we know we have done, and that is aligned with the government priority, and that something is already ready to scale. So it has been tested, it has been done, now it's the scale magnitude. Because if you are the president, you want to see the whole nation, and you don't want to just see some locations. I think that is the pitch that will work, saying something that this has already been proven, tested, we have borne the cost of all the errors, now it's only success. That will be the best pitch, I think. But to be able to answer, to make such pitch, then we have to look into the communities, the data. So that is the answer to Ipsos colleague, if she is still here. The magnitude, oh yeah, you are. That's where the magnitude lies, is actually at the community data level. I think that's the biggest treasure that any country can hope to have, and really take good care of that data. And this also impacts to your question about what success looks like. Of course, when you are a civil society activist, then magnitude and scale will be what the success look like. But again, it has to go back from an impact evaluation, or some mechanism to calculate. To your question, and I would like to answer that, because in my experience in the pandemic fund, civil society, that disconnectedness is what Loretta and I hear all the time. That messages do not get through, even from us, from civil society members into other civil society organizations. And I think it is a lot more to do with language barrier, and also time zones barrier, all the mundane and logistic things actually, and this will be mitigated, can be mitigated, if we involve we operate in regional level, so we strengthen regional collaborations as opposed to only depending on the global collaboration. And talking about proof, so I'm allowed to tease out a bit of information that CISD is leading an effort with a private sector in Indonesia and an education institution from Indonesia and from outside of Indonesia to bring all the expertise on the table, aside or not touching any government money or any big donor money. So hopefully next year, when we come back to WHA, we can share success story on that. Thank you.
Excellent. Well, colleagues, thank you very much for those reflections. We're almost at the end of our session, but
anyway, you're the chair.
yes, okay. No. So, in the meantime, our keynote speaker, Dr. Calypso Chowdhury, has arrived. Calypso, we're so happy you're here, and we couldn't help. I couldn't have you sit here and not say something, so forgive me, but I am going to call on you just to offer a few reflections from you. Obviously, I know it's been a busy week, but you know, we're here discussing mitigating challenges, unlocking opportunities in global health financing. I know you are the one leading this effort at WHO. You are the one whispering into the ear of the DG about how to address these challenges. It would be fantastic just to have a few moments of reflection from you.
Thank you. And I do apologize. I was across the road for another event. I had this event in my diary for later. It's all my fault, and I'm really sorry. And well, thank you. I'm not sure I'm whispering into DG's ear, but I think obviously we're living through a health financing emergency, a crisis in health financing. We are WHO, but importantly, member states, our countries are, and perhaps the worst is still to come. But at the same time, I think from what I could see from the few minutes I've been here, there's a lot of room to be optimistic. There's opportunities to leverage funding from other sources to get countries to thrive. And I know our DG always says that this is also an opportunity to build countries' self-reliance. And I think that's important. Now it's happening quite fast and in a very chaotic way, but the decisions we make during this chaos and during this sort of haphazard and disorganized withdrawal of aid and the multiple shocks economies are faced with, these decisions will determine how successful countries are in their journey, on their journey towards self-reliance. So we do need to be very both strategic and tactical despite the pressures. And to say perhaps one last point, for 15 years, over 15 years, the World Health Assembly hasn't discussed health financing. And this is changing. On this assembly, we have a resolution being put forward to the assembly by Nigeria and co-sponsored by 25 countries from all over the world, which discusses health financing, domestic and external, discusses the importance of protecting the poorest, preventing people going poor from spending out of pocket, discusses the importance of data, so we don't fly blind, and we know, governments know, national planners, populations, citizens know who's funding what, where the money is going. We're not very good at that. And also discusses the importance of partnerships, working with the World Bank. We're very grateful and very privileged to be working together. Just met our colleagues this morning from the bank. And I think that's an opportunity for us as multilateral institutions to forge closer partnerships and use this resolution to serve the member states and drive this agenda forward. So on a positive note, and again, many apologies for getting involved.
Calypso, that was brilliant. I mean, I think you can tell why we are so lucky to have Calypso at WHO, her leadership, her insights. I think that is a wonderful note to end on, Calypso. I think you've also saved me from attempting to summarize this very rich and robust discussion. I think the idea of using this crisis as an opportunity, right, to think about doing things that were previously unthinkable, to doing things that we might have known that we needed to do, but haven't quite had either the space or the ability to do that. We have that now, and if not now, I don't think we'll ever have it. So On that note, let's think of this crisis as an opportunity for all of us together to co-produce, to co-own, to do better, to fund and imagine a world where these opportunities are realized. So thank you all for coming. Thank you all to our panelists. Thank you again to our hosts, Chisti and Joplange, and look forward to continuing the conversation over the next few days with all of you. Thank you.